You notice a strange pain in your chest, a weight, a pressure, a sensation that starts to radiate down your arm and into your jaw. Your heart races. Your breathing becomes shorter. And, by instinct, many people just think about lying down, having a glass of water, or waiting for it to pass. But that wait can be fatal. When a heart attack starts, the body has a golden window of 60 seconds. 60 seconds that can save your life, or turn everything into a tragic end. And the scariest part, most people do the wrong thing. Some ignore the warning signs. Others try to be strong and don't ask for help. There are those who think they can just drive themselves to the hospital, or simply lie down and wait until it goes away. But what should you really do? What is the right thing to do in the first seconds of a heart attack, even before the ambulance arrives? What can help keep the heart beating until help arrives? In this video, we'll walk you through it, step by step, and based on medical science, exactly what you need to do if you're alone or with someone who is having a heart attack. Before we start, tell me, which city or country are you watching this video from? Drop it in the comments. It's always amazing to see how far this message of care and awareness can travel. And if you can, hit the like button now. You might be saving a life without even knowing it. Number 1. What really happens in the first 60 seconds of a heart attack, and why this 1 minute can decide your fate. Have you ever stopped to think about what happens inside your body in the first moments of a heart attack? It is exactly in this very short window, the first 60 seconds, that life and death begin to fight for control of your heart. In this first minute, a coronary artery, responsible for carrying oxygen-rich blood to the heart muscle, suddenly becomes blocked. It can be caused by a ruptured plaque, a blood clot, or even an arterial spasm. Blood flow to that part of the heart stops, and without oxygen, the tissue begins to die. But your body does not stay silent. It sends clear signals. A strong pain, like pressure or tightness in the center of the chest. This pain can radiate to the left arm, the jaw, the back, or even the stomach. It can be accompanied by cold sweat, dizziness, shortness of breath, and a heavy feeling in the chest that doesn't go away. And what do many people do? They feel this discomfort and think it's just anxiety or simple indigestion. They drink a glass of water, try to lie down, and wait for it to pass. But this wait can cost a life. These 60 seconds are not only the most dangerous, they are also the only chance to avoid severe and irreversible damage to the heart. Think of the example of Helen, a 72-year-old grandmother. While washing dishes, she felt a burning sensation in her chest and thought it was just heartburn. But then came dizziness and cold, sweaty hands. Luckily, Helen realized something was wrong and asked for help immediately. She was rushed to the hospital, and the doctor later said that if she had arrived just 5 minutes later, she wouldn't have survived. That is why knowing these signs and acting quickly can save a life. If you've made it this far, comment the number 1 to show you are paying attention and following all the steps. And don't forget to like the video to help this important message reach more people who might need it. Number 2. The first step that can save your life, and the mistake almost everyone makes. When symptoms appear, your body is screaming for help. But what do many people do? They deny it. Think it's just anxiety, or believe the pain will go away. with a glass of water. Others say, I'll just lie down for a while. I'll deal with it later. I must be tired. These moments of doubt are the most dangerous. You need to understand one thing: a heart attack doesn't wait. Every second lost is a piece of your heart that could die. And if the heart stops, the brain only has about 5 minutes before damage becomes irreversible. What should you do? The first step is not to lie down. Nor to take medication on your own. The first step is to call emergency services immediately. If you're alone, call emergency services right away. If you're with someone, ask them to call while you sit upright. And try to stay calm. But don't wait. Don't try to drive yourself. The risk of cardiac arrest on the way is very high. A study published in the Journal of the American College of Cardiology showed patients treated within the first 15 minutes of a heart attack have up to an 80% higher chance of full recovery, with less heart damage and greater long-term survival. John, 68, started sweating cold while changing a light bulb. He felt strong chest pain, and his wife thought he should lie down. But he remembered a news report and said firmly, "Call emergency services now." The ambulance arrived in less than 20 minutes. He received first aid right in his backyard. Today, he walks in the park every day and is grateful he made the right choice. If you're still watching, write number 2 in the comments. This shows you're paying attention and can help spread this life-saving information. Number 3. The most ignored symptom of a heart attack, and it's often not chest pain. When we talk about a heart attack, most people imagine a sharp pain on the left side of the chest, radiating down the arm. And yes, that is one of the classic symptoms, but it's not the only one. And in many cases, it's not the first to appear, especially among older adults, women, and people with diabetes. Heart attack signs can be silent or different from what's expected. Sometimes, it all starts with a mild discomfort in the neck, jaw pain, or even a strange burning sensation in the stomach. Other common signs include cold sweats, nausea, extreme unexplained fatigue, and sudden shortness of breath even at rest. These symptoms are often underestimated, but they are real alerts that the heart is in distress. According to the National Heart, Lung and Blood Institute, over 30% of heart attacks in women happen without chest pain. And in older men, the signs can be mistaken for indigestion or muscle problems. That's what happened to Mr. William, 73 years old. He woke up feeling a strange heaviness in his back, like he had slept in an awkward position. He spent the day complaining of fatigue and nausea, thinking it was something he ate. Only at night, when the pain worsened and he had difficulty breathing, did his children take him to the hospital. There, they discovered he had a silent heart attack during the night. He survived but was left with complications that could have been avoided if the signs had been recognized earlier. So pay attention to your body. Even the most subtle signs can be cries for help from your heart. If you're still watching, write the number 3 in the comments. Your participation is very important to help this knowledge reach more people. Number 4. The most common mistake: waiting to get better on your own instead of asking for help. In moments of chest pain, shortness of breath, sudden nausea, or cold sweats, many people do the same thing. Sit on the edge of the bed, take a deep breath, and think ... It's probably just an upset stomach. It will pass. But this is the mistake that costs the most lives in heart attack cases. Waiting, delaying, believing. The body will recover on its own. A heart attack is sneaky. It doesn't shout. It doesn't make a scene that it whispers at first. And if you don't listen, it takes you. According to the Heart Foundation Australia, chances of surviving a heart attack drop by half if treatment doesn't happen within the first hour. This first hour is called the golden hour. In medicine, it's when there's still time to save heart muscle or at least reduce damage. But with each minute lost, more heart cells die. What could be treated with medication can become surgery, permanent damage, or the end. And you know what's hardest? Many wait not out of ignorance, but out of fear of bothering someone, embarrassment to call an ambulance, or the old habit of saying, "I don't want to trouble anyone." That's what happened to Anne, 69 years old. She had lunch, felt a tightness in her chest, and went pale. She thought it was just reflux. She lay down, drank some water, and waited. When she fainted in the bathroom, it was too late. She survived, but with heart damage. Now she lives with limitations that could have been avoided. So, please, strange feelings, unusual pain, sudden discomfort, call for help. It's not weakness. It's wisdom. The heart doesn't wait, and you deserve to live. If you're still watching, write number 4 in the comments. And please like the video. This action can help this warning reach those who still think it will get better on its own. Number 5. Silent heart attacks in older adults. When there's no pain, but the risk is real. Many people imagine a heart attack always comes with intense chest pain radiating to the left arm, like in the movies. But in older adults, the body often doesn't give that warning. Do you know what often happens? The older person feels mild fatigue, sudden dizziness, weakness, or mental confusion. It may even seem like a simple discomfort, a developing flu, or just a bad day. And that's where the danger lies. This type of heart attack is called a silent heart attack. It's more common in people over 60, especially those with diabetes or a history of high blood pressure. According to the Mayo Clinic in the United States, about 45% of heart attacks in older adults don't cause chest pain. That means nearly half of heart attacks can go unnoticed if the person doesn't recognize the subtle signs. That's what happened to Mr. George, 75 years old. He woke up feeling slightly dizzy, but thought it was just his blood pressure fluctuating. He went to the market, came back more tired than usual, but insisted on making lunch. He only sought help when he started having trouble speaking. The diagnosis? Myocardial infarction. Today he says, "If I had known heart attacks can also cause weakness and dizziness, I would have gone to the hospital in the morning." So if you or someone close to you feels unexplained weakness, sudden paleness, mild shortness of breath, nausea, or cold sweats, even without pain, go to the emergency room. Silent heart attacks are sneaky, but can be beaten with information and quick action. If you're still watching, write number 5 in the comments. This exchange helps spread knowledge that can save lives. Number 6. The biggest mistakes that still cost lives, and how to avoid them. In the panic of a heart attack, it's common for people to make impulsive decisions thinking they're helping, when, in fact, they're making the situation worse. This doesn't happen out of ignorance, but out of fear, haste, or the habit of trying to handle everything alone. One of the most dangerous mistakes is trying to drive yourself to the hospital. At first glance, it seems faster. After all, waiting for an ambulance can take time. But what many don't realize is that during the first minutes of a heart attack, the body can react unpredictably. The heart can go into arrhythmia, blood pressure can drop, and the person can lose consciousness within seconds. Now imagine this happening in traffic with other lives around. A rushed decision can end in tragedy. Another common mistake is drinking water, tea, or eating something light, thinking the discomfort will pass. But this can complicate emergency medical procedures. If surgery or an endoscopy is necessary, for example, stomach contents can delay everything and increase risks. Also, liquids and food don't relieve heart symptoms, they only mask the danger. Waiting for it to pass is also a mistake. Many people believe it's just anxiety, indigestion, or a scare. They wait an hour, 2 hours, sometimes a whole day. They only seek help when symptoms worsen. But during this time, the heart can suffer irreversible damage. According to the Heart Foundation Australia, the faster the treatment, the greater the chance of surviving without lasting damage. Every minute counts. This isn't an exaggeration, it's an emergency. And perhaps the cruelest mistake of all, staying silent. Many older adults feel unwell but prefer to hide their symptoms. They don't want to worry their children. They say it will pass, it's nothing. And when family members realize, it's often too late. This choice to not bother anyone has been the final act of many good people who could be alive today. The truth is, none of these mistakes come from malice. They come from fear, haste, and the habit of handling things alone. But now that you know, you can act differently, and maybe even save someone around you. If you've watched this far, type 6 in the comments. This shows you care about your life and the lives of those you love. It also helps spread this message to those who don't know yet. Now you know what to do in the first 60 seconds of a heart attack, and more importantly, what not to do. This information may seem simple, but it can save lives. It could save yours, or someone you love. Here on the channel, we believe knowledge is care, and care is love in action. So if this video helped you, please like and share it with those who need to know this. And if you want us to cover other topics like this, leave your suggestions in the comments. We read them all with care. The content of this video is based on scientific studies. References are in the description. Thank you for watching. See you in the next video.